Okay, students, so in the discussion of ethics, it's being emphasized that nursing is both a vocation. No, nursing is a vocation, calling, and a profession. I just would like again to differentiate on the meaning of vocation, calling, and profession. Plus, when I talk about vocation, oftentimes students, your vocation refers to, your vocation class refers to your job. Your vocation students refers to your livelihood. Okay, that's your vocation. Class, when I say calling, oftentimes the term calling students would refer to your inner desires. Okay, class, your calling means your inner desire. So for example, I would say, I really want to be a nurse because I would want to care for people. That means, class, it's a calling. It's my calling to become a nurse. When I say class profession, it's more of credentialing. It's more of credentialing. What do we mean, class, by credentialing? Meaning you need to have the credentials in order for you to work as a nurse. And for you to work as a nurse, you need to graduate from a school which is recognized by your CHED, your Commission on Higher Education. So class, you need to be able to finish the BSN program. So your Bachelor of Science in Nursing program. So in your case right now, you have your 4-year curriculum. In the past class, there were times wherein that is a 5-year curriculum and so many other curriculum. But the main point is that for you to become a profession, you should have undergone the proper education, and then another one, you should take the examination. So class, you have education and examination. For the examination students, that will be your nurse licensure examination. You have your nurse licensure examination. Okay, that would make you become a registered nurse. And that will be the time that I can already say that, hey, you are already a professional. You are already a professional. Okay, because you already have the license. So we oftentimes say that the requirement to be a professional nurse is BSN RN. In other words, 4-year program, and then you have your completion of your board examinations. Who among you, what's the idea? What's the passing mark in the board examinations? What is the passing mark in your board examinations? Students, your passing mark for your board examinations is an average of 75%. You need to have an average of 75%. Take note, this is still according to Republic Act 9173, which is, again, your Philippine Nursing Act of 2002. So that is your Philippine Nursing Act of 2002. Plus, according to this law, RA 9173, the passing mark for your board examinations is 75%. Plus, there are 5 examinations there, commonly referred to as NP 1, 2, 3, 4, and 5. Plus, the NP there stands for nursing practice. Okay, it stands for nursing practice. So nursing practice 1 to 5. Plus, the rule for you to pass the board examination is that you need to have an average of 75% and there should be no score less than 60%. No score less than 60%. In other words, even if your average year students is 95, but you got 50 only in med-surg, you will still not be able to pass the board examination. Okay? Even if your average is 85, if you got low in the psychiatric nursing component, you would still not be able to pass the board examinations. Okay? Kindly take note of that. Huh? So that's how it goes, and that's how it goes. Now, so class, when I say vocation, calling, and profession, we have differentiated it earlier. But try to look at this now as we go along the discussion. So nursing class, like medicine, is considered to be honorable service. And you would also have altruistic motives. Plus, when I say altruistic motives, give me a word, guys. Give me a word that would be synonymous to altruism. What is that one word that is very synonymous in the description of altruism? Something that starts with letter S. What word is best used to describe altruism?
Selfless, sir.
Okay, very good. Selfless. Class, selfless. So when I say class altruism, you are becoming selfless. And then class, it says that nursing is essentially humanitarian. In other words, class, we are focused on the lives of the human beings, on the care of the human beings. So what does this imply, no? Even class, I differentiated to you the terms vocation, calling, class, and profession. At the end of the day, it's very difficult for us to separate all of this. At the end of the day, again, it's very difficult for us to separate all of this. Why? Class, look at this. Nursing is essentially humanitarian. Class, it's very difficult to survive something humanitarian if it is not your calling. Okay? What do I mean by that? For example, class, if you're a nurse, even if you are a registered nurse, you can't just go to the workplace and say, hey, I'm just here to earn money. Okay? Wala akong ganang magtrabaho pero kailangan ko ng pera. Okay? At the end of the day, you can say that, but you could not survive the profession by just saying that. Because after all, your nursing class in its roots, in its history, is inclined on altruism, it's inclined on humanitarianism. So even though what will you do if you want to be a nurse, it needs to be your calling. Because it's very difficult for you to survive the situation if you are only seeing it as an opportunity for you to work. Okay? Plus, there is one quote that I remembered which says that once you consider or once you love your work, it will not be work anymore. Okay, it would not feel like work anymore. What do I mean by that? Okay, picture yourselves like students, no, who are not motivated, for example, to go to the class. Let's say, for example, you hate my subject. And then you're like waking up, oh, we still have class with him, I hate him. Diba? It seems to be tiring, no? It's just as if that you're just surviving the day. And you'll just say, oh no, I'll again have class with him. I don't like him. It's a very tiring day. It's a very long day of talk with him. In the same way, students, if you hate your job, it's as if you're dragging yourself every time you're going to the hospital. Okay? It's as if that when you're going to the hospital, okay, you'll say bad words, you'll curse, and then you'll say, oh no, I'm still going to the hospital, but I have to work. No? And that goes back to my point that it's very difficult for you to survive nursing. It's very difficult for you to survive the healthcare profession if you don't love your profession and if it is not your calling. Okay, kindly take note of that. Now, there are different ethical issues no, that we have been repeating on the previous discussion, but then there are different classifications of this ethical issue. Now, look at this one. This classification class or this list no, would list the most common ethical issues encountered by our patients. So you have nurse and physician, among nurses, supervisor, nurse and patient relatives, and then matters of aseptic. Now, nurse and physician, the usual struggle encountered in the clinical setting is who is more superior? Is it the nurse or the physician? What would be your answer to that, students? If you will be asked who is more superior, is it the nurse or the physician? What would be the best response?
The physician, sir.
Uh-huh. How about others? Angelique, I could not hear you. Uh-huh. How about others? Sige na, it's okay to.
Physician, sir.
Okay, I can see, I can hear that. Okay, class, if I heard it right, our three friends here said that it's the physician who is more superior. Okay, students, let's already correct that notion, ha? If you would look at history, yes, doctors are more superior than us because that's the medical career that has emerged first compared to that of the nursing profession. But at present, if you will be asked who is more superior, is it the nurse or the physician? Class, there is no answer to that because we are on equal footing already. Okay, we are on equal footing already. Now, why is it then, sir, considered an ethical issue? Because just like your misconception, it's still common in the hospital. Okay, there are still cases in the hospital wherein they will say that the physicians are more superior than the nurses. You would encounter that. Okay, even class others still believe that nurses are slaves by the physician, and that's not true. That's not true. Don't ever let it into your mind that you are little compared to the physician. Okay. I don't want you to say that let's have a battle with the physicians, but you know what? A good physician is also able to acknowledge that without nurses, they would not be able to care for their patient. Okay? Without nurses, they will not be able to care for their patients. Why? Look at nurses class. It is us who are staying with the patients 24/7. We are the ones staying with the patients 24/7. Doctors class would just do their rounds and then it would take them around 15 to 30 minutes to one patient. Okay? Then that's it for the entire day. That's it for the entire day. So that's why students, no, even physicians actually at present are not acknowledging or not looking at us as their slaves, no? They're not looking to us as their slaves. They also have already the modern thinking. And they have already come to an understanding that if they will continue, okay, if they will belittle the nurse, it will make their life actually more difficult. It will make their life actually more difficult. That's why physicians already have an open mind. But you might encounter instances wherein they will say, ay, si Doc bahala, si Doc bahala, si Doc bahala. Take note, class, you are a separate profession. Okay? In other words, if you will be asked, do you have the education and training to care for the patients? Do you have the education and training class to care for the patients?
Yes, sir.
No, yes, we have. Okay? That's the best answer. Yes, you have the education and training. Okay? It's just that physicians may had additional training. They had more training than us, but we also have education and training. Next, isang makulit sa area is the conflict among nurses. Okay? Conflict among nurses. That's why if you could take a tip from me later on, okay, once you will be in your profession, once you are starting in your profession, please don't take a fight. Okay? Please don't take a fight class with the nurses. Huh? Don't take a fight with the nurses. It's not really advisable. And then other than that, students, there are times kasi no, that other nurses would be, for example, the senior nurses, there might be instances that the senior nurses would be demanding a lot from the junior nurses, especially for those who have just came in the area. Okay, so class, take note that your purpose there is learning. And then if it's too much at present, you're already encouraged to speak out. Okay, for example, let's pick, for example, Kate. Now, for example, Kate is having the duty. And then I'm the senior nurse on duty. And then I'm like, Kate, please give medicines to my patient. Kate, please carry out the order. Kate, please go to room, blah, blah, blah. You need to wipe the butt of the patient. Kate, you need to clue. You know, if it's all about Kate, Kate has all the right to say, sir, I'm so sorry. I have also patients to attend. I am very much willing to help you, but right now I can't do it. Okay? So you can say that outrightly already. Unlike in the past, it's as if to be taboo. It's as if to be unacceptable for you to say, sir, ayaw ko. Okay? In the past, that's not accepted. But right now, you can speak out. Now, supervisors. Oftentimes, class, you will also encounter problems with your supervisors. Okay? For example, your area is too busy and then your supervisor is nowhere to be found. Okay? Supervisors, a supervisor, they should be available in the area whenever you will be needing them. Whereas actually your supervisor might be dealing with bigger concerns. And then here comes you as a nurse, you're very worried, you're very worried that your supervisor is not there. And you're becoming war freak already. Where is my supervisor and the like? So those are some ethical issues. No? Now, another, between the nurse and the patient relatives. Look at that ha, not the patient, but the patient relatives. Uy, kaya kayo ha, kung may pasyente kayo sa hospital, huwag kayong toxic ha. We usually call that toxic. No? You know that feels wherein the patient is having difficulty of breathing, your patient is having fever, your patient is having chills. Okay? So, kumbaga, your attention supposedly doon kay patient. But here comes this patient relative who talks a lot. Here comes this patient relative who asks a lot. Here comes this patient relative who would demand a lot. Parang titingnan mo, ma'am, sino pong may sakit? Kayo or yung pasyente ko? Yeah, parang ganon. But you need to address them. You need to address them. Or else they will keep on bubbling. They will keep on talking. So you need to tell them, ma'am, I am addressing the concerns right now with your patient. Please also be patient. Okay? Ma'am, I will update you if there's any progress. I will update you once there's any change on the condition of your patient. You also need to understand that your patient's relatives are only acting like that because what are they feeling? Why are they acting like that, class? Why are they restless? Why do they follow up a lot? What's the reason why they are doing that?
They're worried, sir.
Okay, very good. They're just worried. Okay, they're just worried. They're also anxious if what's happening to their patient. But sometimes if stress ang nurse, dead siya. Okay? Sometimes pag stress ang nurse, sasabihin, ma'am, pungko, upo. Okay? Huwag masyadong makulit. So I hope that you will not be doing that, ha? I hope that you will not be doing that. Plus, what's the best approach if ever there's a restless relative? You can tell him, ma'am, please calm down. I am addressing the situation. Pero don't shout and say, ma'am, calm down. Pag ganun yun, class, magsusupukan kayo. Okay? Away, World War III lang yung mangyayari. Ha? And then, class, as a nurse, once you did that to your patient or patient relatives, it is you who will be held morally liable. Okay? Because as a nurse, you should understand that they are going through something. Okay? Always, students, remember that when you're dealing with people, do not reprimand the person. Instead, reprimand the behavior. Okay? One example. For example, if somebody touch your hand, let's say, for example, in the clinical setting, here comes this young relative of the patient, and then that young relative finds you to be beautiful, and then na parang, oy, humihirit. Okay? Di pa touch hand effect. Plus, one thing that you can say is, sir, I don't like your behavior. Sir, I don't want you touching my hands. Okay? You say things like that. Do not say, sir, I don't want you. Or do not say, sir, I hate you. O, anong pinaglalaban? Okay? Sabihin lang, sir, I do not like that you're touching my hands. Or, sir, can you please refrain from touching my hand? Okay? In the same way, halimbawa, sir, pag mag-progress pa siya, halimbawa, hindi lang hands yung tinouch niya, halimbawa, private areas na, you could actually say, sir, please stop doing that. You're not supposed to touch those parts. Tapos nag-continue pa, sir, I will call the security. Okay? You need to do that because we give zero tolerance to abuse, whether that will be sexual abuse or verbal abuse. Why? If you will not be doing it, class, that behavior will actually continue. That behavior will actually continue. Because anong iisipin nila? Okay lang naman pala sa kanya eh. Wala naman pang reaction, baka gusto niya rin. Okay? Or maybe they would perceive, she's weak. I can do it again and again. Okay? So please do not allow those to happen. But if you can notice, I'm not teaching you how to fight them. I'm teaching you how to defend yourself. Because class, at the end of the day, kapag ikaw na nurse yung nagsuntukan, talo ka class, talo ka. Because you are a nurse. You ought to be humanitarian. You also understand that people has mental health problems that they need to deal with. Okay? So pagpapatulan mo yung somebody na may mental health problem, ikaw po yung talo. Take note, class, ikaw yung talo. Now, matters of asepsis. When I say class asepsis, saan nangyayari yung asepsis? What's asepsis based on what you've learned in fundamentals of nursing? Where does that occur? Sige nga. Sige na, students. Asepsis.
Surgical, sir. Like, ang clean technique, kag sterile technique, sir.
Sige. How about others?
Like mga man, sir,
Predate.
disinfection, sir.
Okay. Disinfection. Sige. Others? You're also
Absence of microorganisms, sir.
Okay, presence of microorganisms. Now, plus, we're talking here ethics, no? And you might be wondering, sir, why is aseptic there mentioned? So, plus, if you can recall Funda, it says there that we are differentiating between clean technique and then aseptic technique. So, class, when I say aseptic technique, one class is that it is used during surgery, as mentioned by your classmate. So, class, when I say aseptic technique, as the term other class would say, you are trying to remove as much as possible all the bacteria. Okay? I think somebody has mentioned sterile technique earlier. That's correct. Your goal for aseptic technique is sterility. Now, why is it becoming a medical issue? Or why is it, becoming an ethical issue? Okay? Because class, sometimes nurses, medical professionals, even if they had a breach of your aseptic technique, they are not saying it. Okay? Even though class, if they have a breach of aseptic technique, they are not saying it. Okay? I'll give you one example. For example, I'm wearing gloves. I'm wearing already gown. That should be aseptic, right? Diba? Aseptic na. Kasi sterile gloves, sterile gown. And then here comes my perspiration, and then I did it like this. Am I still sterile? Am I still sterile if I did it like this? No.
No, sir.
No, sir.
No na. No. Kasi this class is, my perspiration is considered wet. And then class, when I talk about sterility, anything that's wet is not considered to be sterile. Now what happens? What's the tendency? Healthcare professionals have the tendency not to talk about it. Kasi parang sabi niya, pumahid lang naman ako ng pawis. Okay, it's just perspiration. Why worry about it? That's already a matter of aseptic. Okay? One thing, for example, you're wearing sterile gloves and then your cell phone beep. Your tendency is to pick up your cell phone. And then class, after you pick up your cell phone, for example, you'd go back to the procedure being done. Are you still sterile?
No,
Hindi
sir.
na.
No, sir.
Okay? Hindi ka na sterile. Okay? That's why plus the matter of asepsis is becoming an ethical issue because the question there is that, are professionals really telling the truth whether they are sterile or not? And then if they will become unsterile, are they saying it? Are they reporting it? Or are they doing things to amend it? Okay? Which means that, for example, I accidentally touched my cell phone. For example, my cell phone is here. I'm doing a sterile procedure. And then my patient class is let's say, for example, I touched the cell phone. For example, my girlfriend texted me, and then I touched my cell phone and I replied. The best thing that I could do supposedly is to change my glove. I could change actually my glove. Okay? That's why later on it would come to an extent wherein you would ask yourselves, would I need to report the doctor because I've noticed he did something unsterile? Would I need to report another nurse because he did something unsterile? So ethics class will tell you report it. Okay, for example, Harvey and I are working. And then I've noticed Harvey touched his gloves wrongly. One thing that I can do is that, Harvey, do you want to change your gloves? Okay? I'm not saying outright, no. Imagine naman kasi if you are in the situation in the OR, there are 5 of us there or maybe more. And then I will tell Harvey, you are unsterile. Okay? So Harvey might feel bad because I reprimanded him in front of many people. But if I will tell Harvey, do you want to change your gloves? Okay? That's already a signal to Harvey, you were unsterile. And then if Harvey would say, sir, why would I change my gloves? That would be the time that I can tell Harvey, I've noticed that you were unsterile seconds ago. So would you want to change your gloves? Okay? So class, you better tell the truth. Why? If there is a breach on asepsis, what could possibly happen? If there is class a breach in asepsis, what could possibly happen to my patient? There will be, you can use the cat box.
Complications.
Infection, sir.
Okay, very good. That particular complication is your infection. That particular complication is your infection. For example, patient just came in for the removal of a tumor. Yes, tumor is big and we are happy that we will be removing it. But after 3 days, the patient had severe infection. Okay, breach of aseptic technique is the usual reason. Okay, to take note of that, it would entail a lot of expenses and suffering on the part of your patient. That's one thing lang, class. Now, one thing that you need to remember. Will this be helpful to my patient? If it is helpful to your patient to say the truth, doubt no more. Tell the truth. Tell the truth. There's nothing wrong. For example, in the case that I've given with the work that I have with Harvey, for example, if I will just call Harvey's attention, no harm will come to the patient. If the patient was exposed to microorganisms, it's still minimal. And then Harvey also, if Harvey would continue with his behavior, that the hands are unsterile, after 3 days, Harvey's attention might be called still if there is presence of infection. And then Harvey will be investigated because there is some break on sterile technique. So class, it's better for you to tell the truth and address it right away. So address it right away. Then you have the relational center. Class, what do I mean by relational center here? So we are talking here about the evolution of ethics. So how did ethics came about? How was ethics in the past? So students, in the past, ethics was seen to have a relational center. When I say class relational center, so relation. Okay? What's the basis of ethics? Relationship. Relation. The earliest class American journals like that of 1889 begin by identifying 7 classes of relationship that the nurses need to have to be ethically bound. Now, what are these 7? Okay, so class, look at that. 7 groups of people. Family, doctor, family, friends, and then servants of the patient, herself, own friends, hospital and school, and other nurses. So it says here that as a nurse, we have an ethical duty among these people. If you can notice, no, you can notice that it was way back 1880s because even the term servants is present there. Diba? At present, we are not into anymore using the term servants, especially in a democratic country. No, so we are not talking about servant. But this is an old literature. That's why it says that nurses have the responsibility to all of these groups of people. Now, let's talk about the nurse-patient relationship. Class, oftentimes during the nurse-patient relationship, there will be personal secrets that will be divulged to you. Okay, there are personal secrets that will be divulged to you. Now, can I publish this secret in the social media? Can I see
No.
your faces answering that? Okay, no, you could not. Can I share this personal secret of my patient to my to other nurses? Can I?
No, sir.
Generally, no. Generally, no. But take note there, I have the clause generally. Now, can I share this information to the doctor? Can I share this information to the doctor?
Yes.
Yes, sir.
Okay?
Yes,
Plus,
sir.
actually, it would still depend on the information that is being given by your patient. Okay? Let's give common examples lang. Halimbawa, class, if the patient would tell you, nurse, secret lang ha. Secret lang to. I have an allergy on seafood. Will I tell the doctor or keep it as a secret?
Yeah,
Tell the
but
doctor.
sir.
Tell the doctor, sir.
So class, this time you really need to tell the doctor. You really need to tell the doctor. So allow the patient to talk, and then by the time class that the patient is done talking, you can tell the patient, sir, I understand that you trust me and you respect me, and thank you for sharing the information. I just would like you to know, sir, also that I will be informing the doctor about your allergy, about this and this. Okay, so that plus the patient's trust would still be maintained. Okay, now, for example, you're dealing with a patient class who is pregnant. The patient is about to deliver, manganganak na siya. And then class, the patient said, no, nurse, secret lang ha, secret lang. You know what? Positive ako sa Hepa B. Okay, positive ako sa Hepa B. Shall I inform the doctor and other nurses, or shall I keep it to myself because it's a very sensitive issue to have Hepa B?
Tell the doctor.
Tell the doctor.
Form, sir.
Okay, so class, not only the doctor, but you also inform the healthcare team. Okay, why class? Hepa B. Hepa B is transmitted through food or blood? Sige na, testing lang.
Blood.
Hepa B.
Blood,
Okay,
sir.
class. Your
Blood,
hepatitis B is actually transmitted
Blood.
through blood. And then by the time that the patient class will be pregnant, okay, by the time class that the patient will deliver, okay, sino ba naman ang nanganak na walang blood, di ba? Kahit normal delivery yan, kahit cesarean section yan, there will be blood. And your companion's class will be exposed to blood. Okay, so that's why you need to inform the physician. You also need to inform class the nurses who will be handling the patient. Okay, take note ha, nurses handling the patient. Okay, so for example, if we are in the ward, let's say for example, Angelique, Jeremy, we are both working in the same ward. If I am the patient assigned to this patient with Hepa B, if I am the nurse, assigned to the patient with Hepa B, I don't need to inform actually Angelique and Jeremy because they are my fellow ward nurses. But I need to inform Jessie and Angel who are working in the delivery room and who will receive this patient in the delivery room. You get the point? So I don't need to inform my companion here in the station, uy, Angelique, uy, Jeremy, alam mo may Hepa B yan. Okay? Marites mode yan. Don't like that. Okay? That's no. But I need to inform Jessie during endorsement. Jessie, I would like to inform you that the patient is positive for Hep B because Jessie will take care of her in the delivery room. And it is Jessie who will be exposed in blood. And what will be Jessie's intervention? In the OR class, usually they would have double gloving. They would also have another layer of gown. They would make sure that the gown is disposable. And then they would have goggles, no? Just to anticipate blood spurts, no? Just to anticipate blood spurt. Or else class, they might acquire vitamin. They might acquire hepatitis B along the way. Okay, kindly take note of that. Now, another. What about if the patient will say, class, let me go back muna alitan. The usual picture kasi class when you are doing your assessment is like this na. For example, if I'm dealing with patient Stephanie, I would tell patient Stephanie, Ma'am Stephanie, I will be doing an assessment. Rest assured, ma'am, that this information will be kept private and confidential unless it needs to be shared with other healthcare professionals and your doctor. Okay? So kumbaga, class, at the start, we assured them of the privacy and confidentiality. That's one way for us to gain the trust of your patient. And diba in health assessment, you are reminded, for example, if you have your notebook, you don't go there and then write in your notebook while you're asking to your patient. So you're not like saying, Mommy, I know your sexual history. 2 times a day. Tapos sulat, 2 times a day. Okay? As if you're writing everything, you'll make your patient actually suspicious. Okay? And you will make your patient uncomfortable. But, okay, now going back to the example na. So muna, no? At the start, you need to ensure the patient and privacy and confidentiality. And let's say during the convo that you're having, the patient said, Nurse, I'm actually planning to end it all. I'm actually planning to end it all. That sentence class signals that your patient is planning to.
Suicidal, sir.
Okay,
Suicide.
your patient is actually planning to commit suicide. Okay, gamay naman nga sigway. If I talk about class assessment, what's best to be used? Open-ended or close-ended questions?
Open-ended, sir.
Okay. In general, open-ended questions are recommended. But class, once your patient would say, I plan to end it all, you can actually respond by a close-ended question. This is one exception to that rule. When your patient would say, I plan to end it all, you can say, Sir, are you planning to end your life? Diba? That's a close-ended question. And you can ask close-ended questions when you're dealing with that. That's later on when you will become professionals na. But in your case, as student nurses, my recommendation is that keep on talking to your friend and then refer to help. No, refer your friend to help. But anyway, going back to that, if my patient would indeed be committing suicide, will I keep the information to myself? Or do I need to inform other healthcare professionals? Sige, what do you think?
Inform other healthcare.
Yes,
Or the
you
other.
really need to inform other healthcare professionals. Plus, one exception to the privacy and confidentiality is when your patient and others' lives are already at stake. Once your patients and others' lives are already at stake. Okay, never mind privacy and confidentiality. Once a life is already at stake, you do it. Another extreme example that I can give you, I was not able to encounter this one actually, but if you might know, for example, you are the nurse assigned to a combative patient. And then during your conversation, you know that this combative patient told you, Nurse, pag makalabas na ako dito ng hospital, dead yan. Dead si Juan de la Cruz. Okay, example. Now class, if your patient accidentally escaped the hospital, if your patient left the hospital without notice, you have all the right to tell the police authorities, Sir, please look for Juan de la Cruz and secure him because my patient threatened his life. You get the point? Diba? It's quote unquote a breach of privacy, but this time actually you're protecting a life. So it's very understandable for you to do that. Plus, another term that we use for this one is what we refer to as privilege. Wrong spelling. Plus, we use what the term privilege communication. Privilege communication. In other words, students, when your patient will be telling you something, you're obliged to keep it to yourself unless it warrants to be shared to other healthcare professionals. Okay? Now, anong common lapse natin dito as nurses? Common example, class, elevator. Halimbawa, kasabay kami ni Chastity doon sa elevator. And then I will tell Chastity, hey Chastity, I have a patient. I would not mention the name, but my patient actually has HIV/AIDS. Alam mo, 20 years old pa lang siya. May HIV na siya. Okay? Now look at that example. You did not name drop, but come to think of it. Who is a 20-year-old in this hospital admitted with AIDS? You're already giving the people in the elevator an idea. Okay, let's look. Who is that 20 years old with AIDS? Okay, ginawa mo silang marites. So again, students and even future nurses, no, I am telling you, you are not supposed to talk with your patient about your patients in public places. You're not supposed to talk about your patient in public places, or else class you will be held legally and even ethically liable about your patient. Okay? Do you have any questions so far?